Welcome to the second video. We're going to be having a look at what affects the development of speech sounds. The first area we're going to look at is attention and listening skills. Often we assume that if children can hear, that they can listen. But hearing and active listening are very different. It takes time and practice for children to be able to maintain their concentration on what they're hearing and to really notice the difference between various sounds. Some children find this very hard and may need support with this. When working on speech sounds with children, you may need to consider their age and their ability to maintain their concentration. Keep your practice short, especially if your child finds it difficult. If you compare it with something that you perhaps find challenging, like maybe going to the gym or doing maths, a long session today may mean that you just don't want to face it tomorrow. So little and often is better. So how can you help your child to concentrate for longer?
Try to slow down when you're talking to your child. Say your child's name. Allow them a moment to shift their attention to you, especially if they are already involved in an activity.
Theo. Good boy.
Get down to your child's level so they can see your mouth moving. Reduce background noise such as turning off the telly. Think about how long your child will listen for. An older child may listen for longer than a younger child. Praise them for doing good listening.
Good boy.
Children will find it easier to listen if they have seating with good back support. Play games that encourage listening, such as musical statues. Draw their attention to sounds in their environment, such as doorbells ringing or dogs barking.
Door!
Another thing that can affect speech sound development is hearing. Some children may have difficulty using speech sounds because they're not able to hear all of them accurately. Glue ear is a common cause of hearing difficulties in young children. This causes the middle part of the ear that's usually filled with air to fill up with fluid. It can make the sounds seem muffled, a bit like when you're underwater. If you have any concerns about your child's hearing, please discuss it with your therapist. It may be that they would benefit from a hearing assessment. Here are a few questions you may want to consider. Are there any hearing difficulties within the family? Does your child suffer with frequent colds? Do they say what or pardon a lot? Do they need the TV turned up loud? Do they rub their ears a lot? Do they respond when cold? Let's move on to another factor that can affect speech. Dummies. Dummies and bottles may be useful to settle young babies, but their usefulness declines after the age of 6 months. Regular dummy or bottle use beyond the age of 12 months can create problems for children, such as reduced babbling. We know that babbling is a vital stage for children before they talk, as it's when they explore all the different sounds that they will use later. A dummy blocks the front of their mouth, making front of the mouth sounds such as p, t, d, difficult to say. The child has less chance to explore sounds and so has a reduced range of sounds in their babble. New evidence suggests that as a result they may be less likely to notice these sounds too. Dummies can also increase the risk of middle ear infections or glue ear. Sucking can encourage bacteria to move from the nose into the middle ear. And finally, dummies can cause dental problems. It may cause the child's teeth to grow in an arch around the dummy. This is how prolonged dummy use can look. So what can you do to help? Always take the dummy out when your child is making sounds or talking. Avoid relying on it to comfort your child. Try some other way, such as cuddling, reading, or singing. Once you've decided to give it up, don't be tempted to give it back. Make sure there are none left around the house. Help your child accept that the dummy is gone by telling them that they're a big boy or girl now. You could get them to leave it under their pillow for the dummy fairy, or encourage them to put it in the bin, or even give it to Father Christmas, the Easter Bunny, or their nursery teacher. And finally, another factor which can affect speech sounds is tongue tie.
A tongue tie is when the strip of skin connecting the tongue to the floor of the mouth is shorter than usual. This affects 4 to 11% of newborn babies and can restrict the tongue's movement. However, tongue ties do not necessarily affect the development of speech sounds. Most children can still move their tongue adequately to eat and speak.
And now we're going to move on to our third video, where we see how we make speech sounds in more detail, the order that they develop in a child's sound system, and the patterns that we may see when children swap them around, and you'll be able to relate this to your own child's speech system. And really importantly, you'll have the chance to see how it feels when we're asked to change our speech. So please keep watching.